Usha, your image is little blurred. Your image is little blurred, if you can see. It's okay. You will have to unmute.
Maybe she is using virtual background.
Yes. Okay.
Should I change?
Hi, Anjuman.
It's okay, ma'am. There's no problem. Okay. Okay. A very good morning to everyone present here today. Thank you so much. This is our fourth and final day of the international webinar series on SDG, sensitive risk communication and community engagement responses to COVID-19, organized by the Department of Mass Communication with UNICEF Assam. We welcome you to today's session, and thanks again for the kind of response we've had during the last 3 days. And today we are reaching the grand finale. So we've had 6 very insightful, very meaningful deliberations during the last 3 days. We had with us Professor David Mould, Professor Jan Service, Professor B.P. Sanjay, Dr. Paolo Mephalopoulos, Professor Seshir Basu, and Professor Claudia Lago. And we had really very fantastic discussions during these 3 days. And today, again, we look forward to 3 more eminent speakers who we have with us. And I'm very, very happy to welcome amongst us today Professor Rohan Samarajiva, who's the founding chair of Liena Asia, Sri Lanka, and his co-speaker, Ms. Ramati Bandaranaike, who is a researcher with Liena Asia too. And we have Professor Mohan Datta, who is the Dean's Chair Professor of Communication, Journalism and Marketing, and Director Care at Massey University, New Zealand. I thank you all once again for joining us today. We also are very, very happy to have with us Professor N. Usha Rani, who would be our moderator for today's session. I welcome Madam amongst us. I would take the opportunity to introduce Professor Usha Rani to you all. Dr. N. Usha Rani is a former professor and currently ICSSR Senior Professor Fellow in the Department of Journalism and Mass Communication in the University of Mysore. She is the former founding director of EMMRC, Educational Multimedia Research Center, established by the University Grants Commission in the state of Karnataka with a mandate to produce educational media products for the students of higher education. She was honored with Lifetime Achievement Award by the Business World Media Group and the prestigious Nadoja Dr. Patil Puttappa Press Award for contribution to journalism education. She won ICSSR International Fellowship to undertake research at UN Geneva in Switzerland. She was awarded prestigious American Fulbright Fellowship twice, in 1991 and again in 2006-07, which is a rare distinction in India. She was awarded the Canadian Advanced Faculty Research Fellowship for conducting research at McGill University, Montreal in Canada. She has won 2 national awards for producing best educational TV documentaries. She has worked on mega and major research projects funded by UGC, few books, and many research publications. The books, Folk Media for Development, Educational Television in India, Challenges and Issues and Communication Research are some of her major works. She has authored 15-volume publications on social development in media, a case study of Karnataka. I welcome Madam Usha Rani amongst us, and she would be introducing our speakers and taking forward the session. But before I hand over to ma'am, I would want to very briefly summarize the sessions that we had today. I will just take a little while to do that. So our first session yesterday was by Dr. Paulo Mephalopoulos. He spoke on the topic, the role of communication for social and behavior change in mitigating the negative effects on children. In his lecture, Dr. Paulo drew attention to the fact that while everyone has been affected adversely by the pandemic, the worst affected are the children. With schools closing down globally, over 1.6 billion children in 192 countries are currently out of school. Not only learning, but also the physical and emotional development and socialization skills of children have been adversely affected. There has been major regressive effect on many of the SDGs related to children. While dwelling upon possible solutions to mitigate the risks on children to an extent, he proposed the implementation of a multi-dimensional model for change, an adaptation of the socio-ecological model to deal with the consequences of this pandemic. He recommended 3 strategic lines of communication to deal with the pandemic and the future of children. Advocacy with policymakers and decision makers, monological and dialogical communication strategies to address actions with duty bearers and caregivers of children, and finally, empowerment communication to engage children in decision-making processes affecting the lives of children. The second lecture was by Professor Seshir Basu. He spoke on the topic, mapping of the communication perspectives of the responses of the Indian societies to COVID-19. In his lecture, Professor Basu observed that while the initial reaction of the people to the COVID-19 crisis was that of fear and panic, common citizens soon rose to the occasion and started taking action to help those at the margins, even where the government machinery could not reach. Such actions, unfortunately, remained underreported in the mainstream media, which often prioritized a hegemonic view towards reporting on the pandemic. The issue was mainly covered from the ideological perspective of the media houses. He emphasized that in such a situation, new alternative channels of communication, people's communication networks must be created and utilized to highlight the perspectives of the people. People need to be made aware of the politics of vaccine and vaccination and not let the large corporate media's communication about it shroud the poor man's misery. He also stressed upon the fact that conducting small communication studies, documenting the communication efforts of peripheral communication groups would be crucial for understanding the role and significance of communication in a pandemic and emergency situation in a multidimensional society like India. The third lecture was by Professor Claudia Lago. She spoke on the topic, COVID-19 produced by alternative activist journalism, perspectives and dilemmas. Professor Lago, like some of our earlier speakers, once again highlighted that the SDGs are all linked with communication as a comprehensive right, especially the SDGs that deal with quality education, gender equality, and reduced inequalities. She asserted that communication is a basic right and the pandemic has become a contestation against it. She discussed about how the 21st century has seen the rise of organized movements by educated inhabitants of the periphery. These individuals who are different from the traditional mainstream journalists help establish a relationship with the periphery and approach the periphery from perspectives of cultural diversity and empowerment. She highlighted one such initiative, a news agency in Brazil, Agencia Mural de Jornalismo da Periferia, started as a blog in 2010, which later became a website, and now produce newsletters, podcasts, and social media. And about 100 people collaborate within this organization. She told about how more than 60 reports on the pandemic from the periphery have been brought out by this initiative. And these reports point to the inequalities about access to the public health system and inquiring about policies that protect the most vulnerable. And it also highlighted about how this agency has been fighting against fake news and misinformation by using accessible language. So this was a brief of the sessions that we had yesterday. We very excitedly look forward to today's session, so I will not delay you further. I now hand over to Professor N. Usha Rani to take over the session from here. Over to you, ma'am.
Thank you, Gaurav. Good morning to all of you. I welcome you all for this fourth day session of international webinar, and this is being hosted by the Department of Mass Communication and Journalism of Tezpur University in Assam in partnership with UNICEF. I must congratulate Professor Sunil Kantbera and Joya Chakravarti and her team for hosting this international webinar on a very important topic. And this is relevant and important, significant at this point of time. And today the topic, the broad area is SDG, Sustainable Development Goals, sensitive, REC, risk communication and community engagement, and responses to COVID-19. There will be two lectures, and there will be three presenters. And the first topic will be handled by two speakers from Sri Lanka. And the topic is risk communication in pandemic, preliminary findings from the Asia Pacific. Our distinguished speakers of the first topic are Professor Rohan Samarajiva, founding chair, Line Asia, Colombo, Sri Lanka. And it will be again addressed, the same topic will be addressed by Ms. Ramati Bandaranaike, who is a researcher in Line Asia, Colombo, Sri Lanka. I would like to introduce the speakers, these two speakers, and I'll start with Professor Rohan Samarajiva, who is an authority, a scholar on policy research in digital sector. And this is a rare expertise because there is depth of expertise in this field, and we have a scholar, and he has founded a think tank that conducts policy research on digital sectors in Colombo, Sri Lanka. Its mission is catalyzing policy change through research to improve people's lives in the emerging Asia Pacific by using ICT. His organization's website says that Asia Pacific is driving the global economy, but within it lies South Asia, which is the home of the world's largest concentration of poor people. Professor Rohan Samarajiva is a member of UN Global Pulse Advisory Group on Data and Artificial Intelligence. He was chair of the ICT agency, the apex body for information and communication technology within the government of Sri Lanka in 2018 and 19, having been one of its directors. He also served as the Director General of Telecommunications Regulatory Commissions of Sri Lanka, similar to the TRI that we have in India. He has served as Associate Professor of Communication and Public Policy at the Ohio State University in US. He was the visiting professor of economics of infrastructure at the Delft University of Technology in Netherlands and honorary professor at the University of Moratuwa in Sri Lanka. His most recent co-authored book is Information Lives of the Poor, Fighting Poverty with Technology. It is published in multiple languages, including English, Burmese, French, and Spanish. I welcome Professor Rohan Samarajiva to this session, and I would like to introduce one more speaker who is going to address this session, and she is Ms. Ramati Bandaranaike, who works in Line Asia in Colombo. She's a researcher. She works on ethics of technology and science, which is again a rare field. We have heard very little scholars, very few scholars addressing this issue. And this is very, very interesting because ethics of artificial intelligence and their relationship to policy, these are vital areas. And we need a dialogue, we need a discourse on these issues. Ramati is currently researching the ethics of data and artificial intelligence in the Asia Pacific and how ethical principles may be implemented in policy. She is also involved in Line Asia's research on platform work with a focus on the experiences of female platform workers. She completed her MPhil in the history and philosophy of science and medicine at the University of Cambridge in 2019. She earned her BA, double majoring in philosophy and science and English from the University of Pennsylvania in 2018, graduating as a member of Phi Beta Kappa Honor Society. Her interests include conceptual and ethical issues in artificial intelligence, the intersection of scientific research and policy, science education, and public understanding of science. She has recently presented a paper on female online freelancers in India and Sri Lanka. She has also published papers on ethics of artificial intelligence. I invite Ramathi Bandaranaike to this session, and she'll be addressing the session after the presentation by Rohan Samarajiva. And just I will take a couple of minutes for my preliminary remarks as the moderator of this session. SDG is the Sustainable Development Goals, which were framed in 2015, and it aims to achieve goals by 2030. It's a 15-year package, and SDG goes beyond the tradition. It has helped us to revisit the concept of development agenda and how it should be defined and how it should be interpreted. And today, because of SDG, we come to believe that development has a multi-dimensional approach. Countries are expected to shape development policy based on sensitive development cooperation. It calls for eradication of poverty and hunger. It advocates healthy lives and inclusive and equitable education besides providing equitable opportunities. Most of the countries, including India, are in the process of achieving SDGs agenda. Now, we were hit by the giant pandemic COVID-19. And as per the stats, there are over 1.65 million deaths in the world, and half of it is in USA, India, and Brazil. Since it has been detected in China, WHO declared a public health emergency of international concern, designating COVID-19 a public health risk to other countries. Upon declaring COVID-19 a global pandemic, the WHO promoted global risk communication outreach. WHO's objective behind this risk communication policy was to persuade the public to be aware of and be prepared to handle the situation that alter their lives. So risk communication is nothing but disseminating accurate information and preventive measures that enables publics to contain disease and eases their fear. It is mainly to contain the disease and minimize its spread and infection. Risk communication is vital to inform and build public understanding of the risk. We are here to do postmortem of the measures and strategies of risk communication. Did we do enough to serve the community during this period whose effect was seen from womb to tomb, from unborn to dead? We got to see all faces of humanity. We had pregnant mothers, distressed children, old people, rise in domestic violence against women, plight of migrant laborers, and dignity of dead. It resulted in deep social, economic, and cultural divide that placed women at a disadvantage as they are made to fight in the homes, communities, and lives. As far as mainstream media in India is concerned, they created a fear culture. They viewed things from fear perspective, framed corona in terms of fear mongering by dramatizing reports. And social media was another platform that we were exposed to. And without checking the veracity of information, we keep on forwarding tons and tons of messages about COVID. And these Facebook and Twitter should have facilitated important conversations about the virus, but they are indulging in sensationalism and misinformation to spread in real time. So we as a humanity have witnessed, experienced, documented one of the longest epidemic turned pandemic, and we are fighting the invisible enemy in human history. And so we have, I stop at this. I have some more comments to make, but I'll join whenever there is a dialogue, whenever there is an interaction. I will introduce the third speaker, Professor Datta, after the completion of the first session and first topic. And now I invite Professor Samarajiva, Rohan Samarajiva, to make the presentations.
Good morning, and thank you for the invitation and for this opportunity to talk about some ongoing research that we are conducting here at Learn Asia. My colleague Ramati will share the slides. Basically, when we looked at, I have been working on disaster risk communication, or now the term is emergency risk communication for many, many years. So this COVID problem is a subset of that. And when we look at the SDGs, you can see that there's a whole range of SDGs that are affected by effective or not effective risk communication, including, of course, the most important one, which is SDG 1, which is a world without poverty. So I won't go into particular analysis of the SDGs per se, because it's across a number of these. The basic structure, so we are going to present to you some ongoing research, as the title says, it's preliminary findings. So the basic structure of what we are going to present is that we will be looking at the most authoritative risk communication practice recommendations. These are based on systematic reviews of extant research. Then, so this part I will do, and then my colleague Ramati will talk about the actual practices of 3 Asian countries with relatively good but different forms of COVID-19 management. How well are they following the recommendations based on evidence? That's the material we can talk about at this point. We'll be doing further analysis of these and other countries in the Asia Pacific, analysis of social media messaging using the access that we have obtained to something called CrowdTangle, a particular analytical window that we have on Facebook messages. And also we are looking at the Gallup Wellcome Global Monitor, which is doing worldwide quantitative assessments of trust in government, in health authorities, in politicians, and so on. And we plan to compile all this into a comprehensive report by the end of 2021. So if I could, Ramati, next. So if you look at the overall problem is one of requiring preventive behavior actions by the public. So citizens must comply with the directions. Now, as we are coming into the vaccination stage, we're going to have 2-stage vaccinations, and it's going to be wasted resources if the people do not take the first vaccination and the second vaccination. So, as you know from having various foreign substances injected into your body, this would involve questions of trust. That has been the reason we are focusing on trust. So if you look at the overall problem, people will respond to risk as they perceive it. I mean, there's no sort of standard way that people respond to risk. It depends on their perception. They verify their perception by various means, including confirmation from other sources, their experiences, and so on. And they're likely to take the actions, which is what we are really aiming for, If they understand that they are vulnerable to the risk, that there is a course of action that they can take to reduce that vulnerability, and that the advantages of the said actions are greater than the potential drawbacks. So we ask the question, who is it who's communicating? And whose directions are these communicators likely to heed? So, if you take the larger question of disaster response, you have disaster management professionals, various people from government, etc. In the case of COVID-19 throughout the world, what we found is that it's mostly health officials. In some instances, you have political leaders such as Angela Merkel and New Zealand's Jacinda Ardern making periodic statements, but generally they don't do it every day. The regular communication tends to be by health officials. In unusual cases, like in Sri Lanka, in the second wave, we had, in the first wave, we had health officials as the primary response. That's the one that we'll be describing. But in the second wave, it's the military commander who has been making the formal announcements. So anyway, we looked at the health authorities, and obviously the people that they pay attention to are the WHO. So in 2017, a research synthesis had been conducted, a massive effort, and a risk communication booklet had been produced and shared throughout the world. The research was supervised by very high caliber expert groups, and the work on compiling the extant research was done in various places. Most of the research that we'll be talking about appear to have come from the Wayne State University in Michigan, in the United States. But Harvard and various other people have also contributed to the research questions formulated by the expert group. Now, we ourselves at LearnAsia have been working on systematic reviews from 2013, including publishing a special section with articles about research on the effects of mobile phones in rural areas, on education, on financial transactions, and so on. So we are very aware of this, and we are very happy to see that, say, one of the weaknesses that we had, which is that we were working only with English language, and the WHO research actually covers all 5 languages: Russian, Chinese, French, Spanish, and so on. We were also at the stage that we were in, we were working primarily with quantitative studies, but now the field has moved on, and they are bringing in quantitative studies as well as qualitative studies. So this is quite comprehensive, and I would encourage anyone who's interested to go into these sites, and all this information is available online. Next, please. So let's look at the WHO recommendations. What is the WHO saying? Ramati?
All right, so we're going to...
No, I need to go through the recommendations. Yes.
Oh, okay, so we have the slide, right?
Yeah.
Okay, got it.
So you can see that the recommendations are presented as A, B, C, and so on. So right at the top, A is about trust. And we are quite interested in the trust issue. So here you can see, I'm not going to go through all the list. You can see it on the slide. They're talking about using multiple platforms. So we go back to that question of people trying to verify. You get the news on one thing and you're trying to verify it on something else. It has to be timely. It must acknowledge uncertainty, and so on. And the whole problem of communicating uncertainty. Because as you can see, at the beginning of COVID, we had a lot of uncertainty about whether it was carried by aerosols, whether it was coming from surfaces, and so on. and those things have to be dealt with. Now let's look at the underlying research. Next, please. The underlying research from the systematic reviews is summarized as follows. So the research shows, now we are not just asserting, but we are doing a very systematic compilation of large amounts of research. And for those of you who have done literature reviews for various purposes, we describe systematic reviews as literature reviews on steroids. This is quite a comprehensive kind of approach using the capabilities of information technology. So they pull a large number of research findings. And one of the, of course, the difficulties with trust, of course, is that the context matters. Next slide, please. So some of the cautious generalizations are that it's important that different parts of government and the media should communicate the same message. Swift responses are needed because otherwise the rumors take hold and then you're responding to them. And the importance of dealing with uncertainty, negative data, and things of that nature. So high trust can lead to higher vaccination and evacuation behaviors, but it can also lead to carelessness in terms of perceiving lower risks. Next, please. So these I'll go through, I won't actually spend any time on. These recommendations deal with community engagement, which is important, but given the time limitations, we're not going into all that. Next one. So now we are in the finance, strategic communication planning, evaluation, and social media. So we have a particular interest in social media, and I think everybody does. So we looked at the social media recommendations. Of course, they say you should engage with social media and that you should have an integrated strategy. And the research finding behind it is, next slide, that this is an area that's very difficult because actually the research is ongoing and unformed and so on. So one of the things that they find is that they have not become routine practices within government. So there is a lot of variability in the way these things are being handled. So for example, you'll see how Taiwan, Singapore, and Sri Lanka are dealing with it. They also talk about big data analysis. Now that we find quite interesting because that's something we will be doing in the coming year. So these are the main issues that I'd like to cover. Just one more on messaging. Risk should be explained not in technical terms. Consistent messages should come from different sources, and early messages should. So those with the communication background, you'll find that this is the main area. And the last slide that I will deal with is the research behind this. So here. Of course, probabilistic and technical terms are a problem, even though many in the scientific fields, we tend to talk about that when we are dealing with uncertainty. There is the emphasis that is given on public health officials. Traditional mass media are very impactful. Messages should come from multiple sources. So you can see that this is not contrary to what we have been talking about so far. Now I'll hand over to Ramati.
All right, thanks, Prof. So here we just want to pull up some key examples based on the preliminary findings of 3 case studies that we've done about communication activities during COVID-19 in 3 Asia-Pacific countries. So we picked Taiwan, Singapore, and Sri Lanka. And the reason we want to do it is because so far as the situation has progressed, they have all had relatively low death rates from COVID-19. So we did the bulk of this research in July to August 2020. So just a heads up that things may have changed a little since then. So for example, Sri Lanka is now going through a major second wave, which started in October, and most of that is not really captured here. So just to flag the time in which we did these studies. So here's a snapshot of the current COVID situation as of the 10th of December 2020, based on the statistics from the Johns Hopkins University COVID Resource Center. And we've arranged the countries in order of increasing number of deaths. So as you can see, Taiwan has had just 7 deaths so far from COVID, and Singapore has had 29, and Sri Lanka so far 144, and it has increased a little since we pulled these statistics. So what I'm going to do now is I'm just going to go through what we've found so far from the case studies and flag some of the major points that arise from them. So let's, as we said in the ordering, let's start with Taiwan. So as we know, Taiwan has been having a particularly sophisticated digital strategy in their overall approach to COVID-19. And that, of course, has extended to their risk communication plans as well. So this case study really shows the government harnessing a lot of digital communications options in order to communicate to the public about COVID-19, both situation updates and also preventative measures that the public can take. So, for example, we have here the Center for Disease Control COVID information website, which gives you guidelines, press releases, and so on and so forth. There were also, at a point in the pandemic, daily press briefings given by the Minister of Health and Welfare. You also had hotlines, so the public could report suspicious symptoms in themselves or others, and regular public service announcements by the Vice President of Taiwan. And this is particularly interesting because we see the convergence of a political figure, the VP, who is also an epidemiologist. So he has the relevant expertise as well. Furthermore, these announcements were broadcast from the Office of the President and available online. So by broadcasting it from the President office, it gives it that added layer of authority. And he was able to use this platform to communicate guidance on practices like mask wearing and hand washing. And that we did have this extensive use of mobile apps. So they were called mask maps or epidemic prevention maps. And this basically tells the public where they can obtain preventative supplies such as masks. Then we have the social media aspects, and I will go into that in more detail in the next slide, but just flagging it here for now. And of course, informational posters in public spaces telling people how to take precautions. So I'm on slide 18 now. So this, we have a listing of the types of messages that we found by looking at the CECC Facebook. TECC is the Central Epidemic Command Center of Taiwan, and it is affiliated with the Taiwan CDC, and also the Ministry of Health and Welfare Line account. So the types of information that they displayed here were updates on confirmed cases and also the specifics of their cases. So for example, the travel history of that person, where that person might have gone. Then of course, numerical updates on case counts, how to take preventative measures, and then updates on policy actions such as travel warnings, or if there was a restriction on travel or some kind of border control information that needed to be updated. Then there were also links to the other information sources as well, so like the CDC website and so on. Then guidance on if one was to visit a healthcare facility, how to keep safe. Then updates on the scientific information regarding COVID-19, updates on investigations and case clusters, and then of course policies that the government had in regard to quarantine, and updates on various restrictions. And then of course the very important policy of clearing up rumors and misinformation. And we flagged earlier the importance of getting in early and kind of beating the rumors to it so that you're not caught up in that cycle of rumor management. So in addition, for the messaging category, we also noticed there was a lot of use of humor. So comedians were actually asked by the government to create memes, and they also used animal mascots to communicate about staying safe. And then there was also a use of images, as we saw in the Line account, about how to take precautions like putting on a mask or washing hands. So that's Taiwan. Now let's move on to Singapore. Like Taiwan, there is also a lot of use of digital media, but also conventional media. So in the conventional media, we had weekly press briefings at one point in the pandemic with main government officials. And there was also attempts to make some of these announcements multilingual to reflect the multilingual diversity of the country. So in terms of social media and digital media, there was a COVID-19 WhatsApp channel, and this would basically send 2 to 3 updates every day with, for example, misinformation and scam alerts, and also linking to credible information sources and government advisories. Then we saw a lot of social media activity from the Facebook of the Prime Minister, Lee Hsien Loong. And then on Twitter, the Singapore Ministry of Health, the government of Singapore's Twitter account, and also the Prime Minister's Twitter account. And there is also an extensive YouTube presence of the government of Singapore that actually has a lot of COVID-19 related content. I will revert back to some of the examples from that YouTube account later on. And then there's the hotline that you can call for inquiries on COVID. And then there was an extensive use also of informative apps and websites. I've just listed 4 here, but there's a lot more than that. And what's interesting is you can see here that it's not just about health aspects. So, for example, the COVID-19 Chat for Biz chatbot allowed people to ask business-related questions about COVID, like how the current situation might affect a business. And then you have FluGoWare, which provides resources for people with respiratory illnesses. MaskGoWare, which helps tell you how to get a mask, and the Trace Together contact tracing app. Furthermore, we have the DORSCON level system in Singapore, which stands for Disease Outbreak Response System Coordination, and it's organized into 4 levels from green to red. So this is an easy way of signaling in a very simple manner the level of risk in a way that's easy to understand. So then in terms of the messaging, there was openness about uncertainty of the disease. And in the last one, I will just highlight the sort of philosophy of the government of Singapore was to use what they call defensive pessimism. And this links back to what we were talking about earlier in terms of risk perception and getting people to perceive risk. So on the one hand, you need people to understand that the risk is high enough that one needs to take certain precautions to keep safe. But also you do not want risk perception to fall once people feel like they've taken the precaution. So it's this balancing act between making sure people take precautions and feel safe, and also not making them too complacent. So this philosophy of kind of defensive pessimism allows them to heighten concern about COVID-19 and not making people too complacent. Then in terms of social media, the government of Singapore Twitter account also sent condolence messages for individual deaths on Twitter. And like I mentioned earlier, the government of Singapore YouTube account was very active with COVID updates, giving press conferences. There are celebrities and experts to do videos, and also giving inspirational messages. And some of the videos were in multiple languages as well. So here is our final case study of Sri Lanka, which is our LMIC example here. So the Health Promotion Bureau around January and February released this detailed risk communication and community engagement plan. I'm not going to go to the plan in so much detail, but I have just put this graphic up, which illustrates how the Health Promotion Bureau how they interacted with other departments and other institutes within the Ministry of Health system in Sri Lanka in order to get up-to-date information about COVID-19. So some of the features of this communication strategy is that there was a bigger reliance on conventional media. So one of the big aspects of risk communication was that during the first period of lockdown and curfew, which was around mid-March to late April 2020, there were daily press briefings. And it featured the then Director General of Health Services, Dr. Anil Jaisinghe, the Minister of Health, Pavitra Vanyarachi, and the Lieutenant General Shavendra Silva, who is also in the COVID-19 task force, among others. But these 3 were some of the main figures who were featured. Then in terms of online information, we had the website of the official Sri Lankan response to COVID-19, the National Operations Center for the Prevention of COVID, the Health Promotion Bureau COVID-19 dashboard, and that provides verified information on case counts, so cumulative case counts, daily increase in cases, number of deaths, and so on. There's a dashboard where you can easily access that information in numeric form. And then the epidemiology unit of the Ministry of Health, which, gave us case count updates and also circulars and directives and guidelines that have been issued by the authorities. In terms of app, there was an app called My Health Sri Lanka, which was launched through a collaboration with ICTA, the ICT agency of Sri Lanka, and also the Ministry of Health. And the goal of the app was to, again, give information and updates on COVID-19 in Sri Lanka and also direct people to useful resources. In terms of social media, there was some social media activity. So, for example, the Health Promotion Bureau and the Department of Government Information have official Viber channels that you can subscribe to get updated information on COVID-19. And then we also see Facebook and Twitter activity by, excuse me, the relevant authorities such as the Health Promotion Bureau, the President, the Prime Minister, and the Minister of Health. There is also the COVID-19 1390 hotline that anybody can call if they want to report symptoms. And then there's the Department of Government Information that puts out regular press releases on COVID-19, and that puts daily case counts, deaths, and also updates on any curfew or restrictions that have been put into place as epidemic control policies. So that sort of left us with the question, beg your pardon, to what extent are the WHO recommendations actually being used? So in the next section, what we did was we looked at some of the WHO recommendations that we talked to you about in the first part of the presentation, and then we looked for evidence in the communications activities of them being followed. So it's important to note that at this stage, this is not a full evaluation of these communications activities. Like we didn't evaluate each and every activity for reach and effectiveness, for example. And you will also see a few blank cells in the table. And the blank cell doesn't necessarily mean this activity did not happen or this recommendation was not used. It's just that at this stage, we were not able to find evidence of it as of now. So we've focused here primarily on the A and C criteria because, as we pointed out earlier, the B criteria was largely about like finance and infrastructural aspects of risk communication, which we didn't really cover in our studies. So in terms of the trust recommendations, we see that all three countries had made attempts to link to functional and accessible services. So in Taiwan, we had the links back to the CDC website. In Singapore, we had the specialized apps and websites. And in the Sri Lanka public health system, you have contacts available at the very granular level. And one of the most granular levels is the public health inspectors, and the telephone numbers of the PHIs and the PHI officers are freely available online, and it's possible to contact your local PHI. For transparency, it was kind of difficult for us to fully assess it at this stage, because to properly assess that, we'd have to take statements and then try to validate them against ground truth. So we didn't really have the scope to do that until that point, as of this point. So we've left that out for now. In terms of timeliness, we've seen evidence throughout the pandemic that all three countries adopted some form of regular updating or regular briefing. It needs to understand, of course, we saw in Taiwan the use of humor, in Singapore, multilingual videos and JOSCON. And in Sri Lanka, we can see on the Health Promotion Bureau website, there were many easy to understand graphics with bullet points saying what to do if you're sick, and so on. Acknowledging uncertainty, we know from the Singaporean strategy of defensive pessimism that there was an acknowledgement of the scientific uncertainty regarding the virus. But as of this point, we were not able to find similar for Taiwan and Sri Lanka. Continuing with the trust recommendations, in terms of addressing and engaging affected populations, given that all three are quite small countries, you have a very strong national level response that attempts to reach as many people as possible. In Singapore, we did find that there was some targeted communications, for example, in Tamil during outbreak in the migrant work dormitories. There has been some criticism of the Singaporean strategy in how they did handle this. Then by self-efficacy, we mean, were the communications actually giving people actionable insights that they could use to protect themselves from the pandemic? And we found evidence of that in all three. In Taiwan, and we have the information about the preventative measures if you get supplies. In Singapore, we had specialized apps, and in Sri Lanka, also on the Health Promotion Bureau website, we had instructions on how to keep safe. Multiple platforms, methods, and channels, that is already evident from the case studies. Then when it comes to social media, we saw that in Taiwan, there was a very in-depth digital media strategy, and we've highlighted that. Singapore also highlighted this in the previous slides. In Sri Lanka, we have also seen social media activity, but we've found that it's been a less prominent mode of RCCE, and there's been more reliance on conventional media, in particular television. There's a much bigger reliance on TV. Then, in terms of assessing whether social media and traditional media were an integrated strategy, this is difficult to ascertain, again, because of the difficulties in checking deeper for consistency across different communication modes. We'd have to go much deeper than we've done so far. Furthermore, about messaging, in Taiwan, we did see that risk was explained using humor, so it made the messages more relatable and easier to understand. Then Singapore, as I mentioned, the Gov Singapore YouTube account, you had these very short, think before you do videos with easy to follow advice on staying safe. Like if you wanted to go out, here's how you could stay safe. And then in Sri Lanka, we also had these easy to understand graphics on the COVID-19 prevention website. And as I said previously, consistency we could not check for at this stage. And in the promoting specific actions, we have dealt with that in the self-efficacy category. So here is a screen grab of explaining one of the responses of one response to the Taiwanese government response. So, beg your pardon. Let's get to the key takeaways that we kind of wanted to summarize from this presentation. Sorry. And the first lesson that we wanted to take away from this case studies was that the government should be mindful of which channels of communication people are most likely to access and direct messaging towards those. And one of the big examples of this is social media. Even though social media does feature in a lot of RCCE strategies, the effectiveness and reach is going to depend on the existing context of those countries. Second, and there might be a different balance between social media and also conventional media. Secondly, it is important to set the expectations early. So like we've said, acknowledging that knowledge about the disease is uncertain and likely to evolve. So, for instance, in Singapore, we saw this with the defensive pessimism strategy that was employed, and it will also help to it will also help to stymie any rumors that might emerge in this. And then we have the holistic communication that is tailored to specific contexts. Because as we said earlier, even though we could not go into as much depth about this, it is important for governments to be sensitive to specific national contexts as well as communication targeted towards groups that might be exceptionally vulnerable due to health, economic, or other reasons. So for example, in health, anybody with a pre-existing health condition, economic, because pandemics affect people differently depending where they are on the economic strata, or other reasons including stigmatization. So I mean, there are many lessons we can learn, but these were the three main ones we wanted to take away. So in a nutshell, it's figuring out the importance of figuring out which channels of communication are the most effective, the importance of controlling messaging and setting realistic expectations early, and thirdly, the importance of holistic communication that is targeted towards different groups. And that is pretty much all we had. So before we thank you and sign off, we want to acknowledge the contributions of two of our Learn Asia research interns who made very valuable contributions towards gathering the background research for these case studies. Yes, so thank you. Thank you for listening.
Thank you, Professor Rohan Samarajiva and Ramati Bandaranaike for the wonderful presentation. And I believe that COVID-19 provided communication scholars a pertinent case studies to observe the delivery of messaging and trace the ecologies in different contexts. And I have reviewed a lot of research on this subject, and there are studies are evolving, and there is enough literature to do papers on this subject now. And so the presentation highlighted the amount of research literature with empirical data available for researchers and scholars, and this will risk communication, as far as COVID-19 is concerned, is evolving, and Rohan Samarajiva emphasized on number of studies that have been already undertaken by scholars, and his own research report is preliminary, as the title itself suggests that it is preliminary, and they have drawn inferences. They are not final conclusions and or the findings. In research, everything is inference. We draw inference, and COVID is such a situation where you can pose only research questions because of uncertainties of the problem and the issues involved. And what came out of this presentation is the use of media. It reiterates the media intervention in COVID, in containing COVID-19, and analysis. And they have done the analysis of social media messaging. And it also talks about how to change the behavior and behavioral aspects of the population. It may be too early to say whether the behavior was changed, but risk communication requires information which is timely, and people should respond immediately. Even the government machinery has to respond immediately. So the timeliness is the feature of the risk communication. And this Professor Rohan Samarajiva has given us enough literature to conduct further research, and there is a risk communication book that has already been published, and it is available with empirical data in all languages, in 5 languages, including Chinese and French. And it is a comprehensive compilation of studies. They have studied whether WHO recommendations were followed, and but the studies had to be undertaken to understand the diversity of culture, language, issues, variables in risk communication. And one thing that emerges out of this is the community engagement. And the study reinforces and endorses that social media did help in the government authorities in community engagement. And they even generalize and say that social media are still tools that have not become routine practices of the government. So in some cases, they have not become routine practices of the government, and it has really facilitated peer-to-peer communication. And that is what some of the studies say. And what I understand is they have not, they have given importance both to conventional media as well as the digital sector. The strategy that they come out with is the digital strategy to engage the community as far as COVID-19 is concerned. And they present us with a number of case studies of Taiwan, Singapore, and Sri Lanka. So in Taiwan, we see it was a mobile apps and social media. It's an out and out digital strategy used to the optimum extent to bring down the fatalities, and even the excuse me, and we see the extraordinary preparedness on the part of the governments in Taiwan and Singapore in handling the situation. And Singapore, hello, yeah. In Singapore, we see the mix of digital and conventional media, but it also reflects the diversity. Whereas in Sri Lanka, they explain why. Ramati, you have to unmute. Yeah, thank you.
That's not me.
Yeah, in Sri Lanka, there are comparatively, when you compare Sri Lanka with Taiwan and Singapore, there are more COVID deaths, obviously, and that is attributed to the use of media that needs to be endorsed with further research data. And it may be too early to generalize and say that it was because of use of media, the death rate came down, or there was increase or decrease in the death rate. It is difficult to say that, but some more data is required, and they have said in the very beginning that it is not full evaluation; it's a preliminary finding. So they start with the caveat that it is a preliminary finding, and there is variation. And some even in Sri Lanka, they have addressed the issue of diversity, but to what extent is not known. But maybe in the next interactive session, we may they will be able to tackle the issues of diversity. And so Taiwan, the final summary is some of the countries have used the social media to an optimum extent, and whereas countries like Sri Lanka, like India, have relied on conventional mass media. And so these takeaways of the project I must congratulate both of them for undertaking this project, because this is invaluable data that they have as to understand the media intervention in COVID context. And so this is they have said that it is a holistic communication. We need to be very, very specific as far as the communication is concerned. And I thank both Rohan Samarajiva and Pramati for the presentation, for an excellent presentation. And I look forward to a more meaningful interactive session. And we look forward to taking up questions after the end of the second presentation. And I once again take this opportunity to thank Professor Rohan Samarajiva and Dr. Ramati Bandaranaike for their excellent presentation. Thank you. Now we'll move on to the second presentation, the second topic, and that is on radical democracies, socialist politics, and pandemic response. The speaker is Professor Mohan J. Datta, and he is the Dean's Chair Professor of Communication, Journalism, and Marketing. He is the Director of CARE, Center for Culture-Centered Approach to Research and Evaluation in Massey University in New Zealand. I like their Prime Minister, and she's a powerful global voice, female voice today. And so this is Professor Datta has worked on community-based projects of social change. He specializes in advocacy activism that articulate health as a human right. Very interesting. And Mohan Datta's research examines the role of advocacy and activism in challenging marginalized structures, the relationship between poverty and health, the political economy of global health policies, the mobilization of cultural truths for the justification of neo-colonial health development projects, and how participatory culture-centered process and strategies of radical democracy serve as axis of social change. Professor Datta, as I already said, remarked earlier, comes from a country that has the most dynamic Prime Minister, Jacinda Ardern, forceful female global leader who declared that their country has managed and contained COVID successfully. My opening remark to this session, very interesting session, is today there are a huge number of infections, deaths caused by this virus. There is collapse of healthcare system. There are economic consequences that we have seen very few of it in modern world. While governments of all countries are responding to the pandemic, now the heated debate is raging in the academic as well as in the media corridors and political corridors about which political system, is it democracy versus authoritarian, which is better positioned to respond to the pandemic. Who performed better is the question that we are debating And we have a distinguished speaker today. Professor Datta is going to address the issue of radical democracy, socialist politics, and pandemic response. Professor Datta, the stage is yours.
Thank you so much, Professor Usha Rani, for that introduction. And I want to thank colleagues at Tezpur University for inviting me to this conversation. What I will do is I will share a PowerPoint slide with you to go through and specifically talk about the work of the Center for Culture-Centered Approach to Research and Evaluation, and refer to the work that we have been doing with migrant laborers across India, Singapore, Aotearoa, New Zealand, within the context of COVID-19. But I will also draw upon my experience working with the World Health Organization on its expert advisory panel on cultural contexts of health, and particularly in terms of developing COVID-19 related responses. So my talk is specifically going to address the question of radical democracies. I will operationalize what I mean by radical democracies and the urgency of building a socialist politics in the backdrop of the pandemic. The author, activist Arundhati Roy talked about the pandemic being a portal. This is also a concept that is highlighted by Naomi Klein, who talks about the pandemic offering us an opportunity to reorganize the world. And in the first part of the presentation, I will outline the argument behind reorganization. Why do we need to reorganize? And then in the second part of the talk, I will specifically talk about the role of communication as the basis for imagining radical democracies. I will, in this context, draw upon the theoretical framework of the culture-centered approach, or the CCA, that I have been working on over the last 2 decades. Quite a bit of this work takes place within the context of India, within the context of our collaborations with indigenous communities, communities in extreme poverty, as well as precarious migrant workers in India. But of course, this work also extends to the advocacy and activist interventions that we develop within the context of Singapore, Malaysia, Indonesia, Nepal, Aotearoa, New Zealand, and the US. I will talk about the concept of communicative equality and discuss the ways in which it helps us to reimagine and reorganize the role of communication, and then finally wrap up with an invitation to reimagine the role of academics, the role of civil society in the context of the question of solidarity with those at the margins. So I will begin by arguing that one of the things that becomes visible with COVID-19, and of course, for most of us that pay attention to the empirical evidence, this evidence has been mounting over the last 2 decades, is that health inequalities have grown dramatically across the globe, between countries as well as within countries. The divide between the haves and have-nots have increased dramatically. And of course, this divide is foregrounded by COVID-19, where both in terms of the trajectories of COVID-19 as well as the impacts of policy responses to COVID-19 made visible these deep entrenched inequalities. So as you can see in this image, and this is also sort of the narrative of the various contexts where we do our work, whether it is in India or whether it is in Singapore, where you see stark differences between the haves and the have-nots, between those with access to economic and political resources and those that are placed at the margins of these economic and political systems. So when you look at the narrative, or the ongoing and overarching narrative of development, the one that is celebratory, that talks about techno-urban utopias is a narrative that is an ideological construction, is a narrative that is a mythology constructed actively by those in positions of power, and it's a narrative that works to erase or hide the deep inequalities that are used by the ongoing neoliberal reforms. So what happened with the pandemic, and of course you witnessed this in India, is that you saw large numbers of migrant workers thrown into the streets when the lockdown was implemented without any notice. Now, for most of the urban middle classes and upwardly aspiring classes, one of the narratives you often heard is that one didn't know that there were so many migrant workers in the city. So where were the migrant workers? And this is the very nature of neoliberal city making, where it actually works to erase those precarities, those deep inequalities, and those sites of exploitation that in fact are integral to holding up these cities and urban spaces. So the pandemic draws attention to the deeply unequal structures that constitute our societies today, with 3 decades of market-oriented neoliberal reforms. As the market has been projected as the panacea to poverty, again, as a mythology, what you see in evidence is that large cross-sections of the population, particularly across the global margins, are left without access to opportunities for laying claims to education, laying claims to work and income and therefore mobility, laying claims to decent housing infrastructures, laying claims to decent access to food, and laying claims to decent places of living. So the structural features of our lives that constitute the inequalities of our lives are obfuscated by the narrative of the market and the narrative of poverty alleviation that places the market as the panacea to these struggles with education, income, and livelihood. You certainly, in a lot of my work, I talk about Singapore being an example or an exemplar of authoritarian neoliberalism, or what might be called extreme neoliberalism, in terms of production of techno-fetish in the service of the market, that actually actively uses those authoritarian techniques to silence worker protest, worker organizing, and worker claims to rights to these fundamental resources. So when one sees, for instance, the celebration of the neoliberal narrative, and you certainly see this in how it interpolates to the context of India, particularly in terms of the production of the smart city imaginary, where many of you will be familiar with this. Singapore is projected as the destination. What you do not see in that narrative or what you do not hear in that narrative are stories of large numbers of migrant workers who live in precarity without access to fundamental conditions of decent housing, decent living, and without access to unions to lay claims to decent working conditions. In addition to that, the conditions of the workers are precarious, such that at any point of time, the workers can be deported if the employers so wish. And the state as well has a series of authoritarian policies in place that prevent workers from organizing, from gathering, or raising their voices. Now, this kind of structural context, then, in terms of the lack of access to the fundamental resources of life, is situated in the backdrop of an authoritarian state that works in the service of the market. So, the narrative of the free market, and you go back to Milton Friedman and the ideas of the free market being emancipatory and liberatory. But of course, that obfuscates is that integral to its functioning is a strong state, often an authoritarian state, that enables the market and the sites of capitalist production to reproduce by the repression of labor, through the active repression of labor. Now, this is constituted in the backdrop of the lack of fundamental access to preventive resources, to healthcare resources. So, in most of these contexts, workers, migrant laborers do not have the fundamental right to healthcare, and that is not actually coded into policy. Inequalities in distribution of the basic resources of life and livelihood that then work alongside inequalities in access to care as well as quality of care. So these features of inequalities can be tied to capitalist systems and their modes of organizing, and particularly so to the context of extreme capitalism that you see play out under the structures of neoliberalism, and particularly 21st century neoliberalism, where profit extraction is achieved through the exploitation of labor, but also through the ongoing exploitation of new frontiers of ecosystems and destruction of ecosystems, which is integral to the displacement of communities at the margins into the circuits of capital. The precarization of work, where the ongoing onslaught and attack on worker unions has translated into workers not having the fundamental right to organize and to be represented by unions. So when you consider, for instance, the actual problematic of the workers that you witnessed on the streets of India without access to food, without access to shelter, without access to transportation to get back home. Consider the story of the workers that went to the railway station, found the station to be closed, started walking on the railway line, and then were trampled over by the train. Now, those conditions of exploitation are constituted amidst the attack on unions, such that workers in most of those precarious sectors are not represented by unions and sites of collective bargaining. This is constituted amidst privatization of public resources. You, of course, are seeing ongoing privatization of public resources in India, the latest being the railways. And again, under the neoliberal narrative that privatization will emancipate and create conditions of access for those at the margins. So one of the critical elements of this neoliberal narrative is this, and this is where communication becomes vital, is this work of propaganda in propping up a story of the market that is not borne out by empirical evidence. If indeed the market worked, one would wonder why exactly do migrant workers in a neoliberal mecca such as Singapore continue to be bonded in labor without being able to actually move out of their poverty and get back home. Of course, contrary to that materiality and that empiricism, the neoliberal narrative that is projected on our screen is one of the mobility through pathways of Singapore and through Singapore's neoliberal imaginaries into spaces outside of poverty. Of course, one of the things that we have consistently demonstrated in the work of care is how workers often stay in the work, stay in precarious conditions, even when they do not want to stay in those conditions because they are bonded to the debt that they had taken out in order to come to Singapore, because they make very little in terms of saving money to be actually sending back home, and because they do not really see a way out of that condition. So bondage becomes a really fascinating way to look at a counterpoint to this neoliberal narrative. There's also privatization of communal resources and community resources. You increasingly see our fundamental spaces of access to what we consider as basic resources, like water, like air, being commoditized and turned into private entities to be secured through the market. And within this framework, then, historically, development and particularly health communication, where I specialize, has worked in the service of capital, in the service of the ideology of the free market, and particularly through two particular prongs. One is the ideology of individualism, So in a lot of health communication work historically, and this is the dominant state of health communication work, I certainly see this in WHO and have offered critiques to this in my role with the WHO, which is the ideology of individualism, which assumes that human behavior is a product of individual choices, it's a product of individual attitudes and beliefs, and therefore the panacea to that is to produce the right kind of messaging. So a lot of the health communication work, therefore, focuses on how do we produce the right kind of message, the effective message that would generate the right kind of behavior in the target audience. Of course, completely obfuscating the structural context within which people live their lives. So when it comes to, for instance, the struggles of low-wage migrant workers, and again, I take the example of Singapore, the messaging focuses on how do you ask migrant workers to practice healthy behaviors such as physical distancing, of course, completely erasing the empirical evidence that migrant workers at the start of the pandemic in Singapore often were packed like sardines with 20, 21 workers in one room, often without a window, and often with less than 1 meter of space to move. So a behavior you see within this context, and this is something we demonstrated consistently through our work in the midst of pandemic, that was also picked up by media outlets such as The Guardian and Time, that talked about this notion of behaviors being situated within structural contexts. So it's important to recognize that no amount of effective or efficient or smart messaging would actually work in producing behavior change when communities at the margins don't fundamentally have the structures to participate in those behaviors. In fact, what we have demonstrated empirically through our work is that those are the conditions where that kind of messaging actually produces a great deal of risk to mental health. So, in the ethnographic work we have been doing with migrant workers, they talk about feeling suicidal, feeling depressed, feeling anxiety because of not knowing what would happen, not knowing if they would get infected. And in fact, when you look at the statistics of Singapore then, it is separated out into the statistics for the community and statistics for migrant workers, which demonstrates that deeply entrenched racist classist system that fundamentally thinks of workers as other, as less than, so that they can be counted as something else in the state's narrative of efficient pandemic management. This is also tied to an ideology of techno-determinism, where technology is proposed as a solution to poverty, where technology is positioned as a solution to, within this context, the challenges with COVID. And once again, what gets obfuscated in that is the role of technology as a site of data gathering, as a site of surveillance, and as a site of control. Particularly if you think about, for instance, again, I take the example of Singapore, the Trace Together app that was created by the government. This app was created within the backdrop of a surveillance state that has cameras everywhere and that has strict authoritarian rules about organizing and expressing voice. So in fact, recall that we talked about the sense of fear that is expressed by workers. They often talk about that sense of fear that is connected to being surveilled, being watched, being fearful about whether they can speak out about their conditions and challenges. So COVID-19 in this sense plays out in the trajectories of infection. So this is an image from the migrant worker dormitories in Singapore, where I gave the example of housing, for instance, where the lack of adequate and decent housing is a site where the pandemic plays out. Lack of adequate and decent sanitation, we had workers sending us pictures of toilets that were clogged up, where water was overflowing. They had situations where they didn't have access to enough water to wash their hands and wash themselves. So again, you look at the recommendation that WHO makes about hand washing, and then think about it within that structural context. And what you see is that the place the access to places of living and livelihood, access to decent housing really become vital. A lack of clean drinking water, and then our work on an ongoing basis highlighted lack of decent food, where workers talked about getting sick because they didn't have access to decent food. Just of India, we have completed 97 in-depth interviews with migrant workers, and some of the emergent themes in that work are quite similar to the emergent themes here in terms of the pandemic actually placing the workers in the face of risk, and particularly so in terms of the pandemic response. So it is actual implementation of the lockdown, which is the intervention or the policy that further exposes those at the margins to risks because their bodies become expendable. This also plays out, as we see in our work, in terms of lack of wage and income. This plays out in Singapore, this plays out in India, this also plays out in Aotearoa and New Zealand. In fact, we just published a study in health communication based on interviews with migrants and refugees that talk about the state having a fairly effective response because it also is organized around the logics of equal distribution of resources. And in spite of that, there being struggles with accessing decent income within the context of the lockdown. Experiences of food insecurity continues to emerge consistently in our empirical work. Barriers to accessing testing, accessing healthcare and costs of healthcare. And again, the pandemic itself then placing people in cycles of poverty. So within this backdrop, the culture-centered approach argues that we need to think of, first of all, inverting the dominant framework of doing health and development communication that focuses on communication as messaging and really narrowly defines the work of communication as sending out messages. And instead look at communication as voice, as an opening for listening to the voices of the margins and those at the margins of the margins, and situated at the interplays of culture, structure, and agency. So structures being systems of organizing of social resources, cultures referring to the everyday context, frameworks, interpretive frames and meanings through which communities make sense of their lives, and agency being the everyday capacity of individuals, households, communities to make sense of their conditions and to negotiate them through participation in activities, both to negotiate the structures as well as to transform them. So the culture-centered approach in this suggests that the work of transforming structures lies at the heart of building health communication and creating health outcomes that are equitable. So, if you think about the initial part of the presentation that talked about the pandemic being a site of inequalities, the question then in terms of how do we transform these inequalities? How do we change these landscapes of inequalities? The culture-centered approach argues that we need to think about how resources are distributed, and particularly imagining a politics of redistribution of preventive resources, health resources, income and wealth, and opportunities of life. So just to give you this Amazon example, one of the things I'm sure you've read in the news how Amazon had its largest profits in the midst of the pandemic. Even as you read that story, another part of the story that is often missing from mainstream media is a story of Amazon workers going on strike for not having access to fundamental preventive resources while packing, while distributing the packages. So that's an example in terms of what communication actually can look like as organizing in transforming these deeply unequal structures, where the work of health communication in that sense becomes one of articulating and crafting processes of resistance to these structures of deep capitalism. So communicative inequalities, the culture-centered approach argues, are deeply intertwined with structural inequalities. The erasure of the voices of communities at the margins, the erasure of spaces of representation and recognition of those at the margins, the erasure of the precarious and working classes is fundamentally intertwined with their material oppression, their exploitation, and their deprivation from fundamental structural resources. So then the work of the CCA seeks to build communicative equality, where we look at the question of equality in the ownership of communicative resources. And this is where the argument about radical democracy comes in, where we operationalize radical democracy as communities at the margins and communities at the margins of the margins owning the communicative resources, information resources, resources of representation and decision making, and most fundamentally, resources for voice. This is an image from our ongoing work with the Deccan Development Society and with Dalit women farmers organized under DDS in the form of Sanghams. And what their work teaches us is that the struggle for communicative equality is about struggles at the margins for having a voice so that they can actually shape the narrative and the imaginary of development. In the work of the DDS women, their participation in ownership of these communication resources is fundamental to the articulation of an alternative imaginary of agriculture that fundamentally dismantles and disrupts the neoliberal imaginary of agriculture, which again is highly relevant today in the context of the farmer protests that are taking place across India, where farmers have been systematically disenfranchised from their spaces of livelihood through, again, 3 decades of technocentric neoliberal reforms carried out in the language of development. So, of course, as development scholars, it is particularly salient for us to recognize the ways in which the language of development has been fundamental to the disenfranchisement, both structurally and communicatively, of communities at the margins. So the question then translates into how do we build information infrastructures where communities at the margins can make knowledge claims, can claim structural resources of development and democracy through democratic participation, and where they can participate in decision-making processes. And similarly then, how do we build resources for voice that are owned by communities at the margins, all the way from making decisions to accessing structural resources and distributing them to making knowledge claims. So communication in this sense is rooted in voice, in the question of voices of the margins, and it's tied to power, recognizing that communicative acts, communicative processes are imbued in terrains of power. And to shift these communicative processes, we fundamentally need to change the logics of organizing of power. So this idea of voice then fundamentally dismantles this notion of techno-determinism that works through communication as a form of erasure by incorporating communication as messaging into the state, civil society, market relationship to serve the agendas of capital. And seeing this mechanism as a site for reproducing inequalities can become the basis for us to actually ask, how do we build spaces for listening to the voices of the margins? And this is where the CCA methodologically draws inspiration from the work of Gayatri Spivak, who invites us to learn from below. So how do we build habits to learn from below? How do we build an ethic of listening to the other? Particularly, this is a powerful question in the context of development, and it calls for us to have a great deal of humility in terms of learning to listen. And, it's really interesting because when I do this presentation within the context of development work or development organizations, the response often is, but isn't this community engagement? And my argument to that is that no, that this is not community engagement, because community engagement still keeps power intact in the hands of development agencies and institutions. often situated in close relationship to the logics of capital. So building voice infrastructures at the margins is about building radical democracies where communities at the margins can participate to assert their rights to communication, their right to have a say, and in fundamentally imagining development, and fundamentally imagining COVID responses in ways that are meaningful to their lives. So I will give you an example from an article we recently published in a work that looks at Maori or indigenous responses to COVID-19 in Aotearoa, New Zealand. So something that happened in the early part of the pandemic when the country went into the lockdown, when Jacinda Ardern announced the lockdown, was that many indigenous communities organized in the form of iwi. So Maori are organized as iwi or tribal groups, and the iwi started putting together checkpoints where the iwi would actually monitor who entered into the community and who left the community, and therefore also regulating movement. That's an excellent example of indigenous-led, community-led intervention where communities asserted their sovereignty, or what is considered in Te Reo Maori as Pinoranga Tiratanga, to determine what would be meaningful and healthy for them. And this becomes a basis for working toward another imagination that actually challenges the techno-deterministic, expert-driven narrative that we often see dominate our global organizations. So the work of the CCA, therefore, by addressing these spaces of communicative equality, works toward actually building a socialist politics where distribution of knowledge resources is placed in the hands of communities, where communities organizing, workers organizing, lay claims to rights for distribution of preventive resources of income, education, shelter, and food. So in our most recent work, for instance, with migrant workers, the question that is often emergent from the workers is that how can workers organize into unions so that they can actually lay claims to fundamental conditions of living and livelihood at their workplaces. So this work of co-creating infrastructures, and I will wrap up with this, is about building community groups at the margins of the margins and learning to learn together the habits of democracy, to intervene into state structures so that these state structures are held accountable to the voices at the margins. Design frameworks that critically analyze power and interplace power. And I think this is really vital. And when we talk about our work with migrant workers in Singapore, they will often be the first ones to critically interrogate the state narrative that coming to Singapore is a way for upward mobility for workers. And they will point to their conditions and demonstrate the ways in which coming to Singapore often is akin to labor trafficking, where they have traveled to Singapore without having adequate information, are put in a huge amount of debt to come to Singapore, often close to 10,000 to 15,000 Singapore dollars, and then are stuck in that cycle of debt-based labor. Describing and erasing the sites of erasure, workers talk about how their voices are systematically erased, and the ways in which these are situated within structures. And this serves as a basis for co-creating pedagogies of democracy, for habits of participation and building interventions from within communities. And of course, when these interventions take place from within communities at the margins, the dominant structure, the state structure, often in the service of capital and the market, as I argued earlier, responses with repression. So it's also about anticipating and building strategies for response. I will leave my presentation with these two quotations from two of our community organizers that have worked for a long time on culture-centered interventions. And both of them make a fundamental point about how we organize health and development communication. And they argue that we need to begin by building infrastructures of listening. So Rosie says, and listen to this, the powerful want to tell things the way they see them. So in that sense, development agencies, academics, civil society organizations work in the service of power, those with power, in their own way, in ways that feed their interests. So then she asks, what is your role? Listen to us, work with us, collaborate on things that we can do on the ground that represent our interests. This articulation of our interests is really important in how she is imagining the role of the academic. It has been so many times that our interests are not really heard. The community feels isolated and no place to go to. So we work together in making avenues where our voices can be heard, such that, and this is key, such that they matter. And then I will end with this excerpt from Nadamma, who is a really inspiring women leader farmer at the Indian Development Society. And she says, when we hold these cameras, and she's talking about their work with community radio and video-based storytelling, she says, we tell our stories when we hold these cameras. When we run the radio station in the community, we tell the stories grounded in our life. So it's not the money that the people pay to sell their version. She's referring to the radio advertising that funding. Always about making profit by making fools of us. So on the radio, these are stories of what farmers are really going through here in Warangal and Bastapur, and she's really articulating this in the backdrop of the farmer suicides that have plagued the country. That is another pandemic plaguing India. So with respect to COVID, I will leave you with this particular image. The question for us is, how do we build spaces for community ownership in the everyday? Thank you so much.
Thank you, Professor Mohan Datta, for an excellent scholarly presentation on the issue of radical democracies, socialist politics, and pandemic response. Professor Datta has emphasized on the culture-centered approach and has called upon communication for equality. And he has raised vital issues that needs to be answered, and we need to revisit many of the concepts that we have been advocating in development communication. And he brings out the health inequalities and how COVID has given an opportunity for all governments to expose the health inequalities. You had a market-oriented government, even in India, the largest democracy in the world, but 3 decades of market-oriented, socialist market-oriented country could not solve the problems of health, education, could not bring in the equality, and the immigrants. He emphasizes upon the immigrants, and all of us are, and he captures the emotions, captures the concepts, and captures the emotions that were disturbing when media portrayed the plight of immigrants, leaving the metros and to the villages. And so it makes a very mockery of some of the recommendations of WHO when it says that you have to wash hands, and government says you have to wash hands, and there is no water, there is no toilet, and there is no living space, decent living space. So he gives focuses spotlight on a large number of immigrants in India. And the pandemic drew attention to unequal structures. In his own words, he uses that word, unequal structures, whether it is education, work, housing, food, living, and it exposes us to the failure of the system in providing development. So we have to reinterpret the concept of development. Is it freedom of choice? And do they have freedom? And if not, what is this? And he quotes Singapore, where authoritarian state power showcases free market, and but even he exposes the case of migrant workers, the inequalities, inequalities and the job insecurity that and the lack of voice. He ultimately says communication is rooted in voice. I like that statement very much, and that is a very significant remark, takeaway from this presentation. Communication is rooted in voice, and the voice lacks diversity, and the voice lacks layers, when there are no layers of voices. And then there is, even among Facebook and Twitter, we have homogenized groups, and based on political ideology. And he gives us a very critical approach of neoliberalism. We all thought that neoliberalism is going to serve the humanity, but it is very certain, and that it is not going to help the humanity. And the concept, the ideology of neoliberalism has to be taken with not pinch of salt but tons of salt. And so the narrative, and ironically, it is linked with the bondage. He exposes the layer of bondage in the neoliberalism. So and we all debated that China did well, and India also did well in containing, but it is a questions of sensitivity. When we come to, we feel very guilty of the political ideologies professed by the political parties in power. And he also tackles the issue of techno-determinism of Marshall McLuhan. And technology is projected as solutions to poverty, and how contrasting it is. It doesn't work. And so most of the countries evolved strategies to tackle COVID, but sensitivity to basic needs was relegated to the background in the strategy. Excuse me. He calls upon for the privatization of community resources. There is a state measure initiative to privatize community resources, and he tells us and he expresses serious concern, and we are all definitely concerned about the privatization of community resources. So the ideology of individualism that the health communication strategy professes is something that is brought out, and one of the takeaways, and it's really enlightening to see that the theory, the ideology of individualism in WHO mandate, how it doesn't change the behavior at the grassroots level, because there is no literal community engagement as such. So the behavioral change happens when when you reach the community with the problems, and to address the problem. So he reiterates his faith in culture-centered approach. So the culture variable matters a lot. It is the diversity of the language. The strategy should be diversity. If you don't address the diversity in these days, it has no strategy can keep dividends, can deliver goods. So the cultural perspective as the panacea for transforming structures, and he says that is at the heart of building an equitable society. So it reminds me of Amartya Sen's interpretation of development. He says development is freedom, and freedom of choice, freedom of work. Or do we have that freedom and level playing field? And so the freedom, and do we have that? So it's a entire presentation is about the radical reforms that we should look forward to, or we should have fight for in our own way in any society. So whether it is totalitarian or it is a control system. We claim India as the largest democracy. We watched a celebrity like Sonu Sood use with his team working for the migrants in this country, and so he reached the grassroots. And so we need to talk about the radical democracy, and that is one of the important takeaways. And we have examples. He quoted the examples of many community based, grassroots agencies which are doing human work in this field. And Kabar Leharia is one thing which is doing extremely well. And they have the group of Dalit women have really worked very hard to have their own voice in the country. And today they have gone digital, but their voice has not diminished. Their voice has not changed. the voice is heterogeneous and the voice has layers. And he calls upon that we need to empower the people, empower the voice. So the community, the culture-centered approach is the main takeaway of Professor Mohan Datta's presentation. There are some more issues. Even I would like to interact with him on other issues. But I would like to give opportunity for all our listeners who have endured these presentations for a few hours, couple of hours. And we are going to take up, at the outset, I wish to thank Professor Mohan Datta for an excellent scholarly presentation and giving new insights and new perspectives and reflecting on the most important issue of culture variable in in developing sensitivity in press communication. And so I'm going to take up questions. And there is a question here. I will start with there's Nandi. There is a question in relation to digital platform applications. It has become necessary to create a channel between the population and health government agencies. But for an instance, the Arogya Setu app introduced by the Indian government has raised certain red flags in relation to data privacy. An argument can be made that these applications are sophisticated surveillance systems outsourced to private operators with no institutional oversight. This affects the community engagement. So, how to resolve this issue? I think this is for all three of you, or it's open to the panel, and you have to unmute your mics.
Professor Rani,
Yeah.
because the number of questions have been presented, if you don't mind, I will answer
All of that
in a combined manner.
combined? Yeah, sure. That is most welcome.
So,
Please,
I think
you can see all the questions in your chat box, and
Yeah,
please.
we've been looking at the questions.
Please go ahead.
I think some contextual information is needs to be provided before I get to the specific questions. Whatever the complexion of a government is, of a state structure is, whether it's North Korea, which is a socialist country, or Cuba, or any other country, there is a need in a situation such as emergent pandemic for the health authorities to communicate information. That, I think, is a policy problem rather than a state formation problem. So, in actual fact, I think we know from years and years of doing communication research and discussing these issues that the actual way in which these communicative messages are operationalized, understood, and acted upon will, of course, is not a linear pattern. We are not talking about Paul Lazarsfeld or people of that ilk at this point in time. So the specific, I was introduced as somebody who works on policy, as someone who researches policy and who actually has been in the policy space. So what I had to tell you is that, you see, these particular problems have to be dealt with in that context. Whether we like it or not, people have got to figure out how to tell people whether there is a curfew or not, which shops are open, and how does one get to a pharmacy. Those kinds of information has to be given, right? So there is no claim being made in our presentation in any way, shape, or form that communication by itself is leading to lower fatalities or higher fatalities or any other outcomes. Again, I think these are not things that we need to discuss in these kinds of scholarly settings. in this day and age, because we all know that it's a complementary activity. I was asked a question about, for example, stigmatization. Now, we did not talk about the fact that in Sri Lanka, I mean, we were talking about the Sri Lankan communication strategy, but we didn't talk about the overall containment strategy, which is not test, 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 which is the short form of the WHO recommendation, but it was trace, 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 which is a particular variant that our government adopted. So basically, the greatest emphasis was tracing. When you place the greatest emphasis on contact tracing and you use police and military intelligence as an integral part of your COVID containment strategy, stigmatization is almost a necessary outcome of that. They could have chosen to not do that, like many other governments did. But in this particular country, they chose to trace. So once you get into this trace logic, whatever your communication strategies are, you are going to get stigmatization. And you, even without doing that, in many countries, particular neighborhoods have ostracized people who are either health workers, we've had situations like that, who are either health workers who are living in say, apartments, were not allowed to come back into the apartments. In India, you had Air India crew not being allowed to enter society premises. And so you get this sort of atavistic, almost despicable activities because of the fear that comes from a pandemic. And, historically, you can see pandemics have led to irrational behavior. And in situations like overemphasis on tracing, contact tracing, you get stigmatization. So stigmatization is a serious issue that cannot be dealt with purely. I mean, you can try to control it using communication, but in fact, it's a larger problem than the particular communication strategies and the content of the communication messages. So that's my response to the stigmatization issue, which I think is quite prevalent across our societies. And I think I provided a link to an article about villagers actually, or people in various communities actually arming themselves with sticks and stones and covering their faces with masks, trying to control people coming in and coming out. And in many cases, you get anti-Muslim, xenophobic kinds of things layered on top of these behaviors. So I really want to emphasize that communication by itself doesn't do anything. And our research is in the middle. Our whole idea is to look at how all these things affect trust. So we have got to that part of the discussion. Now, when you come to trust, of course, we have done completely separate work that I wasn't going to present here about the privacy surveillance aspects of contact tracing. So with contact tracing, we have a whole range, what the Swiss have done, what Google and others have presented, where essentially the data sits on one smartphone and is released only when one is sick, and that person can release that information. Or you can have situations where it sits on a cloud, on some kind of common platform, and it can be released with some safeguards. Or you can have situations where it's collected by the government. So it's not about companies. I think the question that I was posed had something about uncontrolled companies. But I think surveillance, in many cases, we have to worry about governments having unlimited access to everywhere you went, everybody who was in contact with you, and so on and so forth. And the last question that I'll respond to, which was specifically directed to me, was regarding the question of credibility. Of course, trust is, I think we showed the research conclusions. Trust is a very amorphous, difficult concept to work with. The question was, something about Tedros, the WHO Director General, having some issues or something like that. The issue is really you don't reduce an international organization to one person. Of course, it is a problem if there are serious concerns about the principal spokesman not being reliable, not being trustworthy, etc., etc. But the fact remains, I think that most of the world's health authorities are looking at WHO as an institution. And in particular, if you look at the way the risk communication document has been structured with various sub-reports and annexes and expert committees and so on and so forth, whether we like it or not, that's what people are paying attention to, rather than the particular idiosyncrasies of Dr. Tedros, the head of the WHO at this time. So I will stop at that.
Okay, thank you. Professor Datta, would you like to take up the questions? Can you read those questions, or shall I read the questions for you? You have to unmute yourself. Okay.
I can read those questions, but before I went to them, I see that there is a question for Ramati, so I'm not sure if she wanted to.
Yeah. Thank you. Yes.
For flagging that.
Bandar Naiki, you have the question. Can you read the question? Can you see the question? Do you want me to read for you?
I think I've got it.
Okay.
Yeah.
Go ahead.
Okay, yes, about the selection of countries. Okay, so, first of all, unfortunately, research is constrained by the available resources. We would have loved to do lots and lots and lots more countries, but given resource constraints, we only can pick a few. The reason we chose Taiwan, Singapore, and Sri Lanka to present today, you're right, they're small, they're basically small islands. So that was part of the justification that we used for picking them, because we thought we might be able to get some kind of, some degree of comparability between the two. However, we have also done a few other country case studies, and you flagged Thailand here. We are working on Thailand as well, but that research is not yet in a position to be presented, which is why we excluded it. So for the purpose of this, we chose 3 countries that are quite comparable. You are right to point out that there are other countries that are not small islands that have certainly succeeded in keeping their COVID-19 case counts down. And in terms of communications, that would probably imply different things as well if the country is much larger and you share borders with other nations. And given size, you probably have to appeal to different kinds of local government structures to make sure things filter down to the most granular levels as well. That's that for that question.
Yeah, thank you. Now, Professor Datta, would you like to take up those questions? Can you read?
Great. Yes,
Yeah.
How about I read the questions out?
Please read it and then answer. Yeah.
So,
and read the name of the person who has posed this question, please.
So the first question is by Stefan Nandi, who asks, COVID-19 has turned out to be the 5-point exploding heart technique on global capitalism. It really has, hasn't it? Some might argue that a radical change is needed, but is a democratic socialist alternative like a Joe Biden or Kamala Harris that wanted change, or is democratic socialism the new progressive neo-capitalism? Thank you for that question, Sipar, and I think it's a great question in terms of the politics of organizing. And I will respond to it within the context of COVID-19 and maybe talk about 3 things that we see empirically from our work. The first thing we are arguing is for transformations to take place is for actually communities at the margins to take ownership of democratic processes. And that means that actually transforming these spaces of democratic participation into sites that are owned by and held accountable to communities at the margins. So, for instance, when you look at the concentration of COVID infections in Dharavi in Mumbai, the question would really be that what would that transformative process be for that particular community to take ownership of COVID-19 response? So that's one. The second question is in terms of strengthening the role of sites of worker organizing and strengthening unions as sites for laying claims to these structural resources, which then sort of feeds into the larger question about how do you organize political parties, political systems, as well as movements to sort of ask this question of what does it take to redistribute the fundamental resources of life and livelihood. So in that sense, going back to the democratic socialist alternative, I think that rather than making a commentary on such a broad field within the context of the US, the argument I will make is that whatever alternative we imagine have to be rooted in holding accountable to communities, and communities having a voice in that discursive process and in those processes of decision making. So as an exemplar, I want to go to the example of community mutual aid that you have seen across many communities in the globe, where communities at the margins have emerged in support of each other to distribute food resources, for instance, to support each other. Now, that kind of community mutual aid is a great vision for an alternative form of organizing, but that can only work when it is connected to holding policy structures and policymakers to account as well. Going back to the next question, which is by Shubhajit Paul, he says, the COVID scenario has also introduced an interesting phenomenon. There is a normalization of the compassionate capitalism discourse. While this might sound like an oxymoron to a socialist, there have been evident instances of corporate houses volunteering for social services. While it could be argued that such CSR has been employed to increase brand value, but nonetheless, the welfare activities cannot be discounted. Neoliberalism is here to stay after all. Your thoughts? I will begin with the argument that neoliberalism is not here to stay. As an ideology, it has been consistently debunked. And I think that if you look at global policy responses, there is increasing recognition that the market left to itself is not going to address problems such as that created by COVID-19. So, and I will give you my experience with WHO to articulate this. So, 5 years back, talking to WHO about the need to move beyond messaging to look at the kinds of recommendations we make to member countries to address the structural contexts would have faced a lot of resistance. Not anymore. If you look at our post-pandemic fatigue response paper from WHO, on which I was a co-author, one of the arguments we make in that is that any kind of messaging, any kind of health communication has to be situated in relationship to the structural context and the structural resources that are being deployed to address pandemic-related behavior. So, and that is a thorough critique of the nudge theory and of the behaviorist paradigm that talks about you create certain nudges and that would get people to behave in healthy ways. So in that sense, I think that there is growing recognition that we need to address structural issues and structural resources. Now, the question about CSR is a fascinating one in that sense. And again, I will go back to the example of Singapore. So when migrant workers had the food crisis within the context of Singapore, you saw many civil society organizations, many private organizations step up to deliver food, okay? And we have since continued to empirically track the experiences of the workers. And what we find is that the food quality improved when there was flow of money and flow of resources. And then come October, the food quality went down to being atrocious. again and really deteriorated. That shows something to you, which is that any form of altruism or alms giving can be, or corporate social responsibility can be band-aid on a situation amidst a crisis, but it cannot be a long-term solution. Now, for the workers to actually have access to decent housing, decent food, decent conditions of living, what are needed is their ability to organize and have a voice. I will quickly go to the last question, which is, on the market interventions and competition advantageous for the society rather than stiff government control? For instance, in the sphere of communication, opening up on the telecom, internet, and airlines to private investment has increased the accessibility and affordability of those services. Now, that's a big question. I will just give a couple of responses in the spirit of dialogue. First of all, let me say that this dichotomy, this binary between market intervention and competition on one hand and stiff government control is pretty much the narrative of the neoliberal ideology. But what I have argued consistently in my work is that, in fact, a strict government control is integral to perpetuating the market and creating spaces for the market. So the market is integral to, as David Harvey would argue, to the state is rolled out in order to enable private capital and rolled back in order to create new markets. So again, Singapore is a classic example. It's an example of an extreme authoritarian state in terms of its repression of labor rights, right? But it is also an example of a neoliberal state that is celebrated as an example of market principles at work. So that demonstrates to you the contradiction in full visibility, that actually to enable the market to work in that context, what is often hidden is the role that is played by the state. And then that also comes back to the question of accessibility and affordability of those services. So one has to ask the question, accessibility and affordability to whom, for what agendas, and to serve what logics of participation. So again, let me give you the example of the mobile phone, because there's plenty of literature that argues within the context of migrant work that mobile phone is emancipatory. And yet what we document in our work is that it didn't matter whether workers had access to mobile phones or not. Within the context of repression of worker organizing, workers not having access to food, shelter, basic conditions of health, actually having a cell phone didn't help them get better access because they were working within the environment of an authoritarian capitalist state that was not invested in addressing those issues. Yeah. So one has to fundamentally ask, what kinds of commodities are we talking about, and how does that relate to the context of labor rights and the rights of those at the margins? Thank you.
Okay. Thank you, Professor Mohan Datta. And I think we have answered all the questions. The panel has answered all the questions. And this...
Usha,
yes?
I have some observations to make.
Please go ahead. Please go ahead. Thank you. I was about to ask. Yeah. Please go ahead. No, it's not clear. It's not clear.
Very rightly, she talked about learn from below and patient listening to an ethnic or other and working toward an other imagination. Now, I will give you a certain example of my state. I belong to a very small state which is not even known to some of the Indians, that is a state called Odisha. And Odisha is a state which is experiencing, and we are facing cyclones on a regular basis. During cyclones also, and in 99 we had the very big cyclone which affected us, and about 1,20,000 people died in that cyclone, and property loss was huge. So it was a devastating effect on our state. So then a new government came, which people say is very people-centric government and popular government by Mr. Naveen Patnaik. And what he did when he came, he started preparing for a machinery which is not to deal in isolation with these pandemics. He thought of building an infrastructure, building a system which will be prepared as a state machinery involvement with the involvement of people to deal with such pandemics. And when we faced another major cyclone, 2012, what happened? The policy of the government was zero casualty policy. And it was a world record. We displaced about 12 lakh people from the seashore areas to safer places, and there was about 30 deaths only during that cyclone. And property damage also could be prevented to a larger extent. And because of that preventive mechanism and also dealing with the pandemic during the cyclone and the rehabilitation measures, the United Nations has given an award to the state government to be the best state to deal with cyclonic disasters like that. And very recently, also the officials from California came to Odisha to study the method, how you are dealing with, because California is also always having floods and all those kind of natural disasters. So they came here. Now, during this pandemic, we are talking of community engagement. I will tell you, it's a case study. For the first 2-3 months, Odisha infection was very less. Maybe about 70 to 76 infections were there. Now, in April, actually, when the migrant labor started trickling into the state, and the migrant labor numbering to about 12 lakh migrant laborers came from Gujarat, from Maharashtra, from Tamil Nadu, several states where they were working. And after their arrival, actually within 7 days, the number of infections kept on increasing. It went up to 3.3 lakh and 3.3 lakh. So what the government did, they really, the chief minister particularly gave power to the panchayat chairpersons, and they constructed about 3,200 community COVID center with the facility of a doctor and also few of the medical staff. And each panchayat chairman was given the power of the district collector, and they were given the power to manage the center there and also to make provisions for the incoming migrant laborers and their food, their drinking water facilities, and even the construction of the temporary shelters for the people. It became much easier because the panchayat chairman knows each and everybody of that village and few of the villages. So he or she has a lot of control and trust and belief of the people. And that actually clicked. And immediately after that, within a month or about 45 days, our infection rate came down to 0.03%. And surprisingly, out of 3.34 lakh infection, the death was only limited to 279. And today, there are hardly in the state, there are 50 to 60 COVID infected patients. So it is not only the community engagement in Odisha was there, but it has not been studied, it is not coming to the limelight, and yet we also had a machinery in place. It's not only at the time of pandemic that we develop such mechanisms, it is ingrained into the system. We have the National Developer Disaster NDRF is there at the central level. We have created a state disaster rescue force, SDRF. We have all the mechanisms. When in Andhra Pradesh there was a large cyclone and flood, Odisha came to their rescue, and also all the restoration works were done by Odisha. So this risk communication or community engagement is rightly practiced there in our state, in Odisha. And that can be emulated by other states. And as regards the WHO guidelines, as regards the UNICEF guidelines, the UNICEF and the WHO were in my state, in Odisha there, and to work in cooperation with the state government and the people. So it was basically a people-centric movement to fight against COVID in my state. That's what I thought that I must share with all of you. Thank you, sir, for giving me this opportunity.
Thank you. Thank you, Behra. You made a very important point, and you drew the attention of the panelists as well as the participants to the Varisa model, ODIA model. And we have heard a lot about it. The grassroots level work is really appreciated, and it is replicable, and the other states can also, and it can be replicated in other regions because it has respected and recognized diversity, and it works at the community level. The point is very well taken. And if there are any other faculty members from your faculty who would like to share their thoughts, they are most welcome before I wrap up the session. Okay. Thank you, the distinguished scholars. We had a wonderful session, very insightful session on risk communication in pandemic. And before that, I just, like Behra, I would like to draw the panelists' attention to, like, I'm tempted to quote Kerala. How can I wind up without quoting Kerala? Kerala is the most successful story, and all of us know that development is a political process, and we have a CPIM, a Marxist government, with coalition partners. And here there are two issues, and Kerala is very successful because it has high religious diversity, with Hindus constituting 54% and Muslims with 26%. And it is the second highest state, next only to Jammu and Kashmir. And it has 18% of Christians, but has linguistic homogeneity, where the entire population speaks Malayalam. So Kerala has received world attention for its topping in development index. It is all there in HDR reports. It is a case study. You review any of in the last 25 years, you find the case study of Kerala. Even in COVID, they did it. The Kerala received world attention, and today it is one of the topmost topmost states in India, which has achieved education attainment, good healthcare, equitable land reforms. And even here in COVID, it did a marvelous thing because they had the political will and volunteerism. The volunteerism is the thing that the spirit of volunteerism amongst party members and members of mass organizations, they all gathered, integrated, and they worked as one community. That is where the success story is. And I must quote Shailaja, the minister. She's basically a teacher like us, and delivered goods, and she handled it. She was able to contain and bring in preventive measures very successfully, and it became a model state in India which could be replicated. So this is the Kerala story, and we in India have the public health in other states, including my state, where the healthcare is in doldrums, it is in bad shapes, government hospitals, and they all got exposed during the pandemic. But it is impossible. We are not expecting all the hospitals to provide bed to every member of the population, but we are expecting some radical reforms. Is radical reforms related to political ideology? Yes, says Professor Mohan Datta. Yes, because development is a political process, and without political ideology, you cannot bring in the changes that you want to. And speaking on the risk communication pandemic, preliminary findings from Asia Pacific, we have been given rich information about the availability of literature, and it is evolving. The research is evolving on pandemic is evolving, and it is the participatory approach in communication, obviously. And there is empirical evidence in support of media intervention. But the question, as it was raised and answered very well by the speaker panelists, it is about the trust. The issue is the trust between the community and the government, and the privacy issues. How are you protect my privacy? Is the issue that citizens, civil society is raising in India, and it is a very important issue, and that has been answered by the panelists. And so the research is evolving, and we have to wait for some more studies to come up with some empirical evidence in support of the examination of other variables like culture and diversity and other issues. And coming to Professor Mohan Datta, who spoke on recommended radical democracies, reforms in democracy, and what we call ourselves the largest democracy in the world, but it is not a true democracy in the real sense of the term. And in COVID, we have revisited all the political ideologies, and he has reiterated the culture approach to development, to change, social change. It is the voice that matters. Freedom of speech. We are surrounded by so many. We are flooded with media, but where is the voice? So the voice calls for diversity. Even media is homogeneous, and there are no layers of voices, despite the presence of the presence of lot of media, flood of media surrounding us. So he calls for structural reforms and transforming structures to establish equitable society. We had a lot of misconceptions about neoliberalism, and he has helped us remove those blinkers. And Professor Datta has helped us to understand the neoliberalism, and the trap that it lays. It is nothing but a market-oriented package, and so most of the countries, I sum up this way, most of the countries have prepared their strategies as per the WHO agenda, but the issue of sensitivity has left a huge gap in the strategy, is what the presentations have reflected on. And I thank the organizers for a very good opportunity and a platform for raising these vital issues, for understanding the intricacies of the radical reforms that are required. And so I thank the organizers, and I thank the panelists for their wonderful presentations, very insightful and scholarly presentations. I thank Professor Vera and his team, Joya Chakravarti, for this opportunity for moderating this session. Thank you. And thank the participants for enduring all the panelists and interactions for a few hours. Thank you so much.
Thank you so much, Dr. Usha Rani, for summing up this session so beautifully. And I once again thank our speakers for today for their very thought-provoking and insightful presentation. Very different presentations we had today in one session, one that talked about government's response to the COVID pandemic and through media-centric interventions, and the other that spoke about the importance of strengthening organic voices and people's participation for dealing with the inequalities. So very different perspectives we had today, and I think that's what made everything all the more interesting and intriguing. So thanks once again, and Before we end, I would like to call upon Dr. Joya Chakraborty to sum up today's, not just today's session, but to actually put in the concluding remarks for this webinar series that we've had, and also do the vote of thanks. Hello. It's a very difficult task to conclude the entire webinar series that we have had, but I think we have had a very meaningful concluding day. That is what I will start with. During these entire series of 4 days webinar, we have had a spectrum of discussions, I would say, which covered the issue of risk communication within a pandemic situation from multiple perspectives. If we started from the engagement of UNICEF and WHO on the first day, where they talked about the structure with which international organizations are operating in India and also globally, their interventions, the specific structures of behavior change which were being advocated, and the strategies which were being adopted for the same. Towards the later part of it, we had some very critical discussions about the role of mainstream media under such circumstances, where it was critiqued as to what sorts of voices and what sort of hegemony was being communicated by the mainstream media during this context of a pandemic. We also had discussions where certain examples and cases of organic voices being raised by people, interventions at the grassroots level were also highlighted, that where people organized themselves on their own to tackle the situation and where the government was not able to reach. Now, even while we can, while we give weightage to the efforts of every government, whatever be the structure of that government's, in terms of dealing with the pandemic in their own way, the importance of the agency of people, the capacities of people to react to that situation on their own and to organize themselves on that, under that situation, and to respond to it, to rise to the occasion, to support their fellow citizen, has also been highlighted during the course of these webinars that we have discussed. And today, we have had two very important things, because when we look the way the society is organized, the governance of the citizenry, these two perspectives, I believe, are very important. One, where we are looking at the policy dimension, we are understanding that there has to be a systematic approach to communicate. It cannot be a vacuum. It cannot be a silence. There has to be a systematic approach to communicate. And then again, the importance that should be given to the voices which come from below, the voices that come from people who are usually unheard, and appropriating the policy and the in a way that it becomes responsive of the structures of inequalities which are there. So I think we have had a spectrum where we have covered all the dimensions which through or the lenses through which we can probably look at that situation. And that is where I believe is a little bit of a success. I may not say a huge success, but as part of the organizing team, I would say that probably we have made an effort to bring together all these diverse perspectives through which we need to look at this issue. I believe one without the other is inadequate. We need to look at all these perspectives, and they're all right and important in their own way. What another intention we also have is that we plan to bring out a video book out of all the presentations which have been put forth over the last these 4 days that we have had, and create a compendium of this discussion. we might want to take it to other platforms as well, but this is one platform that we have thought of to create a video book, which will also have textual as well as video and audio, trying to make it accessible to multiple communities as such. So that's one effort that we would want to take forward from here. Another very important thing which I must acknowledge at this point of time is that the wholehearted support that we have had from all the speakers. Actually, we did contact many of the speakers very recently. We did not give much time for people to prepare, and we are grateful to all the speakers who have accepted our invitations, have responded to our request, and have become part of the deliberation. Some of them are still logged in here, and I would want to put on record my sincere gratitude to all the speakers for finding time and sharing their thoughts and academic views on the broad theme that we have identified for the webinar series. So a big thanks to all the speakers, and another big thank you to all the moderators. We have had the moderators who, again, very well moderated sessions. Some the people who have moderated the sessions have really done it so well in order to hold the sessions together, connecting the people and giving it a proper structure in terms of the discourses that we have had. Today, as I mentioned in the beginning, the participation has been a little low, probably, though it went beyond 100 at a certain point of time. But maybe because it is the daytime and full working hours, people have not been able to log in. But obviously, the recording of the sessions are available on YouTube and Facebook. So I'm sure that the reach would be there. But I still thank all the participants who have registered for the webinar, and they have been giving us their feedback. They have been, we have also been giving some small assignments to people to summarize the lectures and then submit it to us. So that sort of an engagement is also there, which is happening at the background, just in order that we can ensure that the dialogue, discourse, and the deliberations are going on, and just not limited to the webinar time, but we are able to engage even beyond that. So these are just of the concluding thoughts, and I look forward to continuing with this engagement that we have initiated through this webinar in many future initiatives that our department would want to carry forward in this direction, in the field of communication, to ensure appropriate, sustainable, inclusive communication for all. So thank you everyone for being a part of this discourse. Thank you. So I think
we also thank you, Madam. Professor Jaya Chaudhary ji, we also thank you on behalf of Banaras Hind University.
Thank you, Dr.
Really nice.
Thank
and
you,
I can see Professor Behra sir. Thank you so much, sir. You are looking so great, sir.
Thank you, Bala. Thank you.
Even I do have my beard like you, sir. This beard.
Yeah.
Sir.
You're looking like a saint, you know. You're really looking like a saint.
Thank you so much, sir. Sir.
I look like a terrorist.
Not at all, sir. You look like an academician, sir.
Okay, so I think we'll end the session here. So thank you.
Thank you, everybody. Thank you, everybody. Thank you.
So we'll log out.
Bye. Log off. Thank you.
We'll close the session now. Thank you.